Do weight loss medicines, GLP-1 meds, Ozempic, Mounjaro, do they cause cancer? Listen to the episode and you'll find out. We're live with Gross Anatomy Podcast, where we explore the sights, smells, and sounds of medicine, how it relates to movies, TV, books, pop culture, podcasts, and the world around us. And there you go. I'm Dr. Jason Cohen, and I'm joined by
Lauren Taylor.
What are we talking about today, Lauren Taylor?
Well, I, as you know, watch a lot of basketball games, OKC Thunder fan. And during the games, there's a lot of commercials for Lilly drugs. Basically, they're Ozempic type drugs like Mounjaro or Zepbound. And I guess what I wanted you to do is just briefly remind people what a GLP-1 drug is and why these drugs being advertised during my commercial breaks now are saying there's a risk of thyroid cancer or if your family has thyroid cancer, that you should consult your physician first. It basically seems like if your family has a history of thyroid cancer, you shouldn't take these drugs. And I did not know that. And so I thought I should ask the thyroid surgeon expert extraordinaire, you.
So that's what we're talking about today. We're talking about GLP-1s today. We're talking about the new, latest, and greatest weight loss craze.
Yeah, and I mean, we've hit on it briefly before. So, I mean, there's a few other things, just like the wellness trend of like meals now being GLP-1 friendly, meaning they're probably going to charge you more for less, basically, for smaller appetites. But
that's funny.
But they're not necessarily approved by the U.S. Food and Drug Administration, even though these pills are, these GLP-1 medicines.
You know, it's funny. I heard on the radio, either today or yesterday, or the day before, that airlines are saving more money these days on flights because their fuel charges are less because the planes weigh less. And they're attributing it to the GLP-1s because passengers are lighter. And I don't know how real or fake or whatever that is, but that's, I heard it on the radio and real radio, not ridiculous radio, saying that airlines are saying and thinking that they're saving money now because spending less on fuel to get to their destinations, and they're attributing it to the GLP-1s.
Wow, I would have never thought of that. I read an article the other day. I forget what airline it was. Someone was like, it was going around social media, like they were trying to shove an extra row in economy and people had a fit. So the airline changed their mind. They were like, there's literally no room to move.
Yeah, no, it's so unpleasant. So yeah, exactly. I hate travel. But wow, so the GLP-1s, there's you know, there's the GLP-1, which stands for glucagon-like peptide 1, which is basically a hormone that's made in our gastrointestinal tract that helps basically regulate our sugar and regulates our appetite. And the truth is it has many, I think we're still even figuring out exactly all of its functions and all of the things that it can do and does. You know, so it affects insulin and insulin or blood sugar levels and insulin release and insulin is what we need to deal with food, sugar, glucose, all of that stuff. But so that's one role, but then it also has this whole other role of our motility, of moving along the intestines, whether of our whole intestinal tract, from our esophagus to our stomach to our colon, that it slows it down. It slows down, and by slowing down the process, the flow of food stuff and poop and all that, it causes a feeling of fullness. And that's one of the other effects. And then there are plenty of other effects that we're still kind of just learning about. And for now, I actually honestly believe it's a miracle drug. And I think we've talked about it before. And I think, you know, for a while it was weight loss surgery. You know, you'd hear all the advertisements, you know, let your new life begin. Call 1-800-GET-SLIM. I am not paid by them. I don't even know who those doctors are. And for years, it was weight loss surgery. And and their side effects and what weight loss surgery, there are all different ways of doing the weight loss surgery, kind of rehooking up your anatomy, of just making the tube, the stomach much smaller. So there are many different versions of that surgery, and it's effective. But to lose weight with just a pill and not need surgery, I think it's fantastic. Now, the whole thyroid cancer thing comes from all the studies come from lab animals. All of the tests, all of the studies come from lab animals. And in the lab animals that they were testing it on, a rare form of thyroid cancer was the concern. Not the most common, not the two most common, but a rare form that's very familial most of the time, and a genetic form of thyroid cancer called medullary thyroid cancer. And that's the thyroid cancer that it's really associated with. And to the degree of which, I'm not even sure, but that's the one where they say if you or your family have a history of medullary thyroid cancer, which is also associated with some other endocrine syndrome of cancers called MEN, then you definitely should not be taking the pill. But otherwise, the standard because it's a different cell that cancer comes from. It's the parafollicular C cells of the thyroid, which aren't the main part of the thyroid. So
is that a rare cancer to begin with?
It's a rare cancer to begin with. Yeah. So it's a much rarer cancer, much rare. So that's the people. So if you have a family history of that kind of thyroid cancer, or this medullary cluster of type of cancers, this familial cluster of endocrine cancers, then you shouldn't take it. But those are rare. And everybody just extrapolated the thyroid, we should be careful and not take it. And the truth is, we don't really know yet. What I've seen in just hearsay and anecdotally, that there really isn't an increased incidence or risk in these other types of thyroid cancer, the two main common ones. So anybody with a thyroid nodule or concern, certainly if there's a risk of thyroid cancer or something, I always say, get your thyroid checked first to make sure everything looks okay. Get an ultrasound, if need be a biopsy. And as long as you know you don't have thyroid cancer, and even if you have thyroid cancer of the common kinds, my feeling is get that cancer treated, and then you're probably fine to go on these weight loss medicines.
Mm-hmm. Yeah. But so I'm not the only one that's seen these ads and been asking you about it, I have a feeling. Have you had
entire
patients?
World, yeah. And we post a lot about it on Instagram, and it's something to be aware of, something to think about. People with thyroid nodules who decide they want to go on that medicine, I say, well, you can't just forget you have a thyroid nodule. Just like women get mammograms every year, you have to get follow-up ultrasounds, maybe even maybe more than every year, maybe twice a year, depending, and just kind of keep an eye on things.
Yeah, I read. So now it's a pill. It used to be an injection, right? And now they're coming out in pills. You just take what, once a week, once a day?
No, so it started both companies, Eli Lilly and Novo Nordisk are the two main companies that have Mounjaro and Ozempic, respectively. And in the beginning, it was just an injection, and now there are pill forms for both companies. I don't think Mounjaro, there's the pill form out quite yet, but I'm sure it's coming. Okay. The pill is every day. It's a daily pill. You got to take it every day.
Right.
And same way with the injection, where you start out at a low dose to check tolerance, and the recommendation is you take that low starting dose for a month, and then you ramp up slowly. It's pretty much the same thing with the pill. You start the low dose for a month, and then every day, and then you slowly ramp up.
Right. I guess we'll see what in 10 years if there is an actual increase in thyroid. I don't know how long it takes.
Yeah, and not just thyroid cancer. You hear about other incidences of other complications too. Luckily, so far, all of those things aren't that common, and they're rare. But you hear sometimes the horror story of people's total intestinal tract stops working, and which could be horrible, debilitating thing. But I think
Yeah.
luckily the incidence is pretty low. They're tracking data, there's studies continuously coming out. And I think the risk, at least right now, the risk of obesity and diabetes and heart disease, just totally, that risk is just so much higher than all of these other risks right now that I think, at least as of now, it still makes sense for sure to be on the medicine.
Well, apparently doctors are okay with prescribing it because I read that a study by the Kaiser Family Foundation said 12% of U.S. residents are now on these drugs, either for diabetes or weight loss. So.
Yeah, yeah, and then there's studies showing that it helps with sleep apnea. It helps with heart disease. There's even studies that show that it helps with addiction, with nicotine addiction, because it just kind of curbs a lot of that desire. It's really
Yeah, I
interesting.
mean, it does sound like a miracle drug. I guess that's why people probably like me would be a little hesitant. It's like it almost sounds too good to be true. It's like,
And I
what's
think
the
there's something to that. But I think
yeah,
but I certainly know that, if you're on 10 medicines because you're, overweight and have diabetes, that's bad.
right. And those medicines, all medicines have some kind of side effect label warning, so yeah,
Exactly. Exactly.
I see. I see what you're saying.
I have some weird sad news. You know how we talked about how Bernice and I were trying to become yoga
Yeah, New Year's resolution.
instructors? What?
New Year's resolution that
Well,
you're
New
yeah,
Year's resolution to do more yoga, but did we talk about how we decided we were going to become
you're gonna become a yogi. Yeah.
but an instructor in sculpt?
Yes.
It was too much. We backed it. We dropped it. We're dropouts. We're sculpt dropouts. Sculpt school dropouts. So like the week and we just dropped out this past weekend. So the whole time I've been singing in my head, if you're a fan of Grease, beauty school dropout. Da, da. So I've been singing sculpt instructor dropout. Da, da, da.
So explain. Did you go to one class or what
We
was
went
it?
to four class. We went to so it was 4 weekends in a row. 6 hours each class, from 11 a.m. to 5 p.m., and it often ran later. And then a lot of the students are meeting during the week because they have time to review and go over, and there's homework and reading, and then you have to memorize the entire routine and perform it. So Bernice and I, we did the first weekend, and then in the second weekend, we did the first day, and then we're like, we both kind of looked at each other and were like, this is too much for us right now. And like the whole, and then you have to memorize it to music and be able to like be like, okay, and ready, and 3, 2, 1. And we're like, what? We're a little busy right now, and I apologize
I
because the instructors are great, and
yeah.
in one world it would be really cool. Like I still wish I had done it, but I'm like, now might just not be the time.
I mean I could be wrong, but I feel like I can safely say I bet none of the people in your class were also surgeons.
There were a couple of high school kids. There were a couple of college kids. I was the only guy. It was how many there? I think there were like 15 of us or something. I was the only male. It was all female. Bernice and I. There were two other people closer to our age, but I certainly don't think they were. I certainly know they're not healthcare people.
Mhm.
But then they were mostly like, college kids or just out of college and stuff. And so like I'm still on the WhatsApp group. So they're all like, yeah, we're meeting today at 1 in the studio to practice. And we're meeting tonight at 8 or 9 to practice. And I'm like,
So they might have dads that are surgeons that they're living with right now. They have a lot
maybe.
less worries.
Maybe. And it was
But
really kind of fun,
yeah.
but it was nerve-wracking too, to like we had to perform like in front of each other. Like she would call us up and we'd have to do
Mhm.
like a part of the routine. Okay, and inhale, da da da, exhale, and then okay, and now and to music. And now 4 and 3 and get ready to pulse it up. And I was like,
I feel
it
like
was
you're
kind of,
doing it right now.
I
You're
know.
like you're selling it.
I know. It was, it's a little bitter.
Mhm.
The funny thing is, as soon as we decided to drop it, we just became so relaxed. Like it was
Okay.
tensing us up like crazy. So that's how I know we made the right decision. Because as soon as
Right.
we're done, like that following day, we just we were relaxed.
It sounds like way too much with everything else you got going on. But so
Unfortunately, I still feel terrible because the instructors we love and they're great and everything,
mm,
but I don't know. I don't know.
you shouldn't feel terrible. I feel like if you moved to Florida, maybe there's like an easier course you can take or something.
Maybe spread out more. The reason we were doing the course wasn't so much to become instructors; it was just to kind of improve our yoga and stuff. So we did get a lot out of that, but then
Mhm.
at the end of the day, neither of us were really like we necessarily want to teach, at least not at this point in our lives. So
Right.
I do think there's a chance at some point we'll revisit it. I don't know, but it's been, again, on the one hand I'm a little sad because it would have been a cool feather in my cap kind of thing.
Yeah. I
Plus
feel
we
like you
talked about it, so I'm a little embarrassed, that
I think it's good to be honest on a podcast. So you're
yeah.
just being honest.
But it reminds me of something that I think is often a good lesson to people, which is keep stuff under the radar. Don't boast and brag about things. Maybe after you finish, then you could do things. But
I
I think
don't
it's
think
always better to do things under the radar.
I completely agree because I don't like people asking me questions about things that like aren't finished or then like it makes me feel bad about myself.
Right.
But I don't think you were bragging when you were talking about it. You just said it was something you and your wife wanted to do, which I thought
Yeah.
was sweet. Well, you want to go into what we're watching?
I
Because we have been rewatching Lost. We watched Lost like so many years ago, but like we like to have a show on sometimes that we don't really care that much about. Like before you go to bed, you're doing stuff on your phone, whatever. Lost. Jack is a doctor, which I guess I
right.
remember, but I kind of forgot. And in this one episode, Boone dies because he was carried in by Locke, and Locke said he fell from a cliff, but really he was fell down in a plane that he walked into in a tree, and he crushed his leg. But Locke didn't say that. He said he fell. So Jack treated him for a break. He was giving him a blood transfusion, and the blood swelled up in his leg because it was actually crushed, and he died. And that's the importance of telling your doctor what really happened. And I just wanted to share that with you. I thought Dr. Cohen, he's always like, you got to tell your doctor the truth.
Yeah. So today, we record on Wednesdays, which is after we have our pre-med meeting. We just had our first pre-med meeting, official pre-med meeting. We had our intro one last week where we kind of go over the assignments and the rule. But today was our real first meeting, and we had one of the trauma surgeons come and talk to the group. And he actually is part of this program that's called Stop the Bleed, that I think is a international program, Stop the Bleed, that was launched because of disasters and things that would occur, and mass casualties and things like that. So he and one of the nurses who helped run this program gave a mini program of Stop the Bleed for our students today, which is kind of interesting that you brought that up about
Yeah.
Locke, because they talked about bleeding and putting on tourniquets and all of that. So it's almost like you're like meant to be this discussion. It was pretty great.
That is so. What does Stop the Bleed do exactly?
The purpose of it is, I think it may have come from a school shooting where they saw that some kids who died
Okay.
wound up dying not from major fatal injuries. They died from like arm or leg gunshot wounds that just kept bleeding out. And in theory, had someone been aware of how to stop that, which is very doable, either with a tourniquet, you squeeze, some kind of like a band or something around, or put pressure on, these kids may have survived. They might have lost a limb or something like that, but they may have survived. So I think it kind of came from that. It was born out of that, of how can regular people in a trauma like that where there's bleeding, how could they possibly save a life? And the main thing is pressure, identifying where the bleeding is coming from and just try to stop that bleeding long enough for help to come. So that's it. So, and it's interesting in the olden days, and he talked about it, the trauma surgeon, and I remember learning it too. Um, there was the whole thing tourniquet. A tourniquet is like a rope or whatever it is, and you see it in the movies and the TV shows that goes around a bleeding arm or leg or something like that to stop the bleeding. And it was a big thing done in wars. But what would happen is back in the olden days, the soldiers would be injured and they'd forget that they put the tourniquet on, and it would stop all blood flow, and the soldiers would lose their limbs. They'd have to get amputations. So we learned maybe you shouldn't be tourniqueting these people because you don't want them to lose their limb. But then we realized, you know what? You're better off alive without a limb, especially if you get the person taken care of. Maybe you still could keep your limb. And so tourniquets are back. They're back in vogue and in favor, and they've been back for a while now. But it was relearned that so that's where all that came from.
Wow, that's great. I didn't know about that organization. That's really interesting.
Stop the bleed. Mm-hmm.
Yeah, I mean, it is important to know these things. And Travis was like, I feel like Jack's being really dramatic, and he was like, Locke murdered Boone. But then Jack said, he was like, he lied to me about how he got injured. And I'm like, oh, he's just being a doctor. He's being real. Like that, he had to know what really happened to him, and he died. So.
But maybe Jack wasn't a good enough doctor. I don't know.
Well, he was on an island, and he had to use a sea urchin needle as part.
So. I got to tell you, I watched a little bit of Lost in the beginning. Then I would occasionally watch an episode here and there, and then I watched, I think, the final season or two. But I never saw the whole thing, and was never a real pure Lostie. But I did watch a lot of the end episodes. So that might be a fun show to rewatch.
Well, I mean, yeah, and it's kind of ridiculous. A lot of flashbacks, which I don't really care for. But I mean, if you're not like, you can do other things, and I don't know. It's I don't really remember what happened either, or how many seasons we watched. So
yeah, that's interesting. We are watching Tehran. Have you heard of Tehran?
My friend is watching that. I feel like, is that too dark for me?
It's spy. It's a spy thing, which is really cool. We just kind of stumbled on it, and we're in season 2, and we're loving it because it's spy. Yeah, we're loving it. It's spy stuff, and Israel and Iran and spy things.
It sounds interesting.
It's a fun
spy show.
Yeah, so if you like spy shows, then this is great. It's really great. Yeah.
I might have to check that out. And then we keep watching The Pit. We watched the second episode, which you spoiled for me last time.
So that was the second episode, the maggots?
Yeah, but I'm so happy you did, because I knew it was coming, and I looked down the entire time. I was like, not gonna look.
Yeah, you can't eat while watching that show. I don't know if we finished the second episode. I don't remember, but did you watch more than the second episode?
No, we just finished the second episode.
It's amazing, all that stuff, because I had plenty of maggot patients too. I think I've described some of them in the past. So I've seen all of that. It's good stuff.
So that wouldn't bother you at all in real life if you saw it?
Only if I were eating, I think, but otherwise not necessarily. The smell would maybe bother me, but of that guy, that patient. But seeing the maggots, not necessarily.
Good for your gross anatomy coffee book if a patient walks in with maggots in his cast.
Yeah, I still remember when I was in Brooklyn at Kings County Hospital, we had a patient, an old grandpa came in, and he's like, the reason he came in, he was a diabetic, sweet guy, and he's like, why'd you come in, sir? He's like, well, my grandson was playing at my feet and was like, Grandpa, what's this stuff moving around on your foot? And sure enough, he had maggots in he had diabetes. And when you have diabetes, the small blood vessels get don't have good blood supply. And because of that, that's why patients get amputations of their toes and things like that, because bad blood supply. But they also lose their sensation. So you don't necessarily feel much in your foot. So he didn't feel anything, and his toes were dying. They had gangrene, and because they had gangrene, these maggots were in there eating it up. I'm trying to make you vomit. That's my goal right now.
What was the solution? How could you help him? You couldn't? Like, did you have to amputate, or could you just clean it up for him?
Well, his toes were dead, so so we cleaned them, but he needed toe amputations. Yeah.
Okay.
Yeah. And then he needed vascular surgeons to kind of help figure out how to do a bypass and bring better blood flow down there.
Okay. Well, that settles that question.
What else, Lauren Taylor?
That's it, Dr. Cohen.
All right, everybody. Thanks for listening to Gross Anatomy. We hope you enjoyed this.
Thank you.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.